Beck Marie has lived in 2 other provinces with type 1 diabetes, but says it was more difficult to get coverage for vital treatment in Nova Scotia than anywhere else.
It took 3 or 4 months, and in those 3 or 4 months, I was paying about $800 a month for like my insulin. By the time I paid for my insulin, my test strips, my glucose sensors, my insulin pump, all out of pocket, that's about $700 or $800 a month.
Nova Scotia offers 2 programs to cover insulin and the devices people use to manage their diabetes. But to complete the applications, you need the signature of a Nova Scotia-based specialist. Marie says accessing a specialist was the problem since they didn't have a primary care provider, and the wait time to see an endocrinologist who specializes in diabetes treatment was 18 months. So instead of waiting, they went to pharmacies, emergency rooms, and clinics until they found someone who could help.
It was just a lot of me calling around, walking into places, driving to the pharmacy after work, seeing who's available, waiting for an appointment, getting sent back and forth, making a lot of phone calls.
Experts say these devices significantly improve the quality of life for people with diabetes.
It used to be that this new tech was kind of like, oh, nice to have, but now it's really set to be the standard of care for people with diabetes. What we know when people have access to the devices, so these glucose monitors and insulin pumps and the medication that they need, they have better outcomes related to diabetes. They're less likely to end up in hospital. They have longer life expectancy. They have fewer complications.
Marie said one of the main reasons they decided to move to Nova Scotia was because the province had programs to help cover treatment costs. But after having coverage in BC and Ontario, they thought it would be just as easy here.
I use up so much energy just taking care of myself, and then on top of that, all of these barriers to getting on the program for devices that I need to live, it was just exhausting.
The province declined an interview request, but a spokesperson said in a statement that the diabetes treatment programs were designed to help Nova Scotians who don't have a primary care provider get access to the help that they need. The statement says there are diabetes centers located across the province, and anyone having trouble accessing support should reach out to the Diabetes Care Program of Nova Scotia. But Marie says it was difficult getting anyone from that program on the phone, and when they went to one of these centers, staff told them they were either unable to help or unwilling because Marie didn't have a referral. Josh Hoffman, CBC News, Halifax.